Hi everyone, and welcome to the Extensor Tendon Repair Risks and Complications page. I'm Dr. Colin Hong, a plastic surgeon here in Toronto, and I'd like to take a moment to explain the important risks and considerations involved in this type of hand surgery. Extensor tendon injuries can seriously impact hand movement and function. Surgical repair is often necessary for recovery, and with proper aftercare and rehabilitation, many patients regain significant use of their hand. That said, like all surgeries, this procedure comes with certain risks and limitations. These may include tendon scarring, which can limit movement, failure of tendon repair, especially if post-op instructions are not followed, loss of hand function despite successful repair, damage to nearby nerves or blood vessels, changes in skin sensation, stiffness or swelling, infection, bleeding, or delayed healing, visible scarring, deformities, or unsatisfactory results, the possible need for additional surgery to improve function. Recovery often involves a strict rehabilitation plan, and sometimes the final outcome is limited by the nature of the injury or scar formation. Please read the content on this page carefully, and be sure to review the full informed consent document to fully understand all the risks and potential complications. We're here to ensure you feel informed, prepared, and supported, so if you have any questions or concerns, don't hesitate to reach out to me or my qualified team.